Good afternoon, everybody, or rather, good evening. You're at 4 o'clock now. I'm Dr. S. Ramakrishnan. I'm a senior rheumatologist attached to Apollo Hospitals, Chennai. My experience in rheumatology is about 35 years, and I'm one of the first qualified rheumatologists in the country. Now, the basic important point, which I would like to drive home to all of you within the next 45 minutes to 50 minutes, after which we'll have some discussion, is a little about arthritis and the myths and facts which one has to know about arthritis, because we seek knowledge from non-medical people and we get confused about arthritis as such. The first question is, what is arthritis? Arthritis means people develop pain in the joint, swelling in the joint, warmth in the joint, with or without decrease in movement. And there is a problem in structures around the joint that is called as arthritis. The classical complaint of a patient with arthritis is he'll go and tell the doctor, I have got swelling in the joint, there is warmth, it's very movement is very difficult. When I get up in the morning, the movement of the fingers will be very tough. Now there is one important myth I tell you with arthritis. Everybody thinks and tells me, doctor, since there is pain, this is a neurological problem. It is an absolute myth. Arthritis does not have anything to do with the nerves as such. So consulting a neurologist may not help you, because the site of problem is mainly in the joint and it is not in the nerves. The second question myth which people have is, arthritis is an orthopedic problem. Orthopedicians also deal with arthritis, but the major cup of tea is to deal with fractures and injuries, etc. So we have a defined specialty called rheumatologists who deal only with problems in the joint, and they deal mainly with arthritis. So the person who actually takes care of rheumatology, who takes care of arthritis, is basically a rheumatologist, and we in India at present are numerous as far as the species of rheumatologists is concerned. Now we have rheumatologists all throughout the country. They are available in all metro cities, as even then in the other smaller cities as such. The next question which you can ask me is, how many types of arthritis are there? There are nearly 180 types of arthritis. And how is arthritis caused? Well, it can be due to infection. It can be due to autoimmune. What do you mean by autoimmune? The body's defense system fighting against the joint and causing swelling and inflammation of the joint. It can also be due to certain conditions. Like in diabetes, you know, the blood sugar goes up. In a condition called gout, the uric acid goes in the blood, it increases, and then it gets deposited in the joint. It becomes a terrorist, and there is a lot of inflammation going on in the joint as it is concerned. The last cause of arthritis is wear and tear at the joint. Well, you see, I am become bald because of my aging, but I can still tell you there are people at 20-25 itself who become bald. Probably they become wiser earlier than me at that young age. So similarly, in between bones, we have a cushion called cartilage. And once this cartilage gets worn out, then the two bones will develop friction between when they move, and they develop pain, and this is called as osteoarthritis. There is a myth, you know, people tell arthritis will occur only in the elderly. It doesn't occur in childhood, it doesn't occur in the reproductive age group. The fact is, arthritis does not spare any age. It does not spare any religion. It does not spare any nationality. It does not spare any creed. It occurs in all groups of people, ranging from children to the elderly. That's very important. The second myth is, people say that arthritis affects only the females. It is not like that. Among the 180 arthritic diseases, some of them are predominantly seen in women. a condition which we call as rheumatoid arthritis, in which there will be pain and swelling of the joints of the fingers, of the toes, and people will have difficulty in making a fist, especially in the morning. And so if the wife has got rheumatoid arthritis, she won't be able to make a fist and box the husband in the morning. You have another condition called systemic lupus, which is more common in women than men. Now, the reason why certain diseases are more common in women is because of the female hormones. There are two diseases which are more common in men. One is this condition called gout, in which the uric acid gets elevated. The second one is called a condition called ankylosing spondylitis, what we in a layman's term will call it as a bamboo spine. The spine becomes absolutely fixed and rigid like that, and people will not be able to move forward and backward. They will actually be walking around like a robo. So the myth is arthritis occurs only in women is wrong. The fact is it can occur in both sexes and it can occur in all age groups. So we finished what is arthritis, what are the causes of arthritis. Then the second point is the myth that it is common more in females is wrong. It's more common in both age groups as well as both sexes. What is the arthritic condition which we see more commonly in India? As a rheumatologist, because a rheumatologist only sees patients with arthritis. The commonest problem which we see in our practices is a condition called rheumatoid arthritis, in which the joints will be painful, there'll be warmth, you'll have tenderness, you'll have difficulty in moving the fingers and the toes, the knees can get swollen, and this is called rheumatoid arthritis. The basic cause for rheumatoid arthritis is the body's defense system fighting against the joint, so it's an autoimmune condition. Rheumatoid arthritis is more common in women than men. I told you it is because of the female hormones. You can ask me one question. It is a myth going around that rheumatoid arthritis is curable. No school of medicine in this world is capable of curing rheumatoid arthritis, to be frank. We can only control the disease, which means to say you have to take lifelong treatment. And in India at present, we have wonderful medications to treat rheumatoid arthritis. 35 years ago, when I started my career as a rheumatologist, we had very few medications to treat rheumatoid arthritis. Now we have wonderful medications, and India is equally equipped as any other country in the world to treat rheumatoid arthritis well and to make the patients fine to prevent deformities. Now people come and ask me, Doctor, I have got arthritis. Is there any special diet for arthritis? There is no special diet for arthritis, to be frank. What you have to do is to take a well-balanced diet, a well-nutritious diet, and see to it that you do not increase your body weight, maintain your ideal body weight. That's very, very important. Take plenty of green leafy vegetables, take plenty of fruits, and drink good amount of water, at least 2.5 to 3 liters of fluids, especially water you have to take. Is there any special arthritic diet for rheumatoid arthritis? There is no diet at all specifically. There is only in one condition where there is a special diet for an arthritic patient, and that will be this condition called gout. Now, what is gout? In diabetes, what goes up in the blood? The blood sugar goes up in the blood. In gout, what happens? The blood uric acid goes up. Normally, it should be only 7 milligrams. When it goes beyond 7 milligrams, it goes and gets deposited in the joint. It becomes a terrorist and it causes arthritis. This condition is called gout. Now, what this uric acid is an end product of whatever protein we take. So people who have gout should avoid high quality protein. If somebody has got gout and during lunch he is suddenly taken a good amount of non-vegetarian, especially red meat, beef, etc., he should be away from non-vegetarian. That's very, very important. It's not that, to put it in Tamil, Non-vegetarian, you should avoid non-vegetarian. Non-vegetarian should be definitely avoided in patients with gout because non-vegetarian food will ultimately get converted into uric acid. That's very, very important. Now, so as far as diet is concerned, but there are certain important points which I would like to tell you regarding diet as far as this country is concerned. All of us should not forget the grandma's treatment. I tell you one thing in life, old is still gold. Now what they are telling for COVID, you take turmeric, you take pepper, you take ginger, you take spices, because each of them has got some antioxidant activity and it's also an immunostimulant. So as far as arthritis is concerned, especially rheumatoid arthritis, turmeric has been found to be very, very useful. In fact, abroad as well as in India, turmeric capsules are available across the market. Definitely people can take turmeric capsules. It doesn't cause any amount of side effect. So turmeric is a very, very good medicine for decreasing the inflammation in arthritis. Now what happens when people come with gout? We ask them to avoid non-vegetarian. First thing what happens is I see a lot of people from the northeast where fish is like drinking water for them. They'll ask, can I avoid fish? When I tell them please avoid fish, then they'll say, can I take small fish? So whether we take a big fish or 20 small fishes, it amounts the same. So you should avoid high quality protein whenever somebody has got gout, especially fish, beef, red meat. Now some people come and tell me, doctor, you see, I don't think arthritic people should stop taking alcohol. Arthritic patients should not take alcohol at all because the medications which they take can have a tendency to cause ulcers in the stomach. Alcohol and painkillers is a very, very dangerous combination. Especially in gout, you should definitely avoid alcohol, especially beer and red wine. It's very, very important because these are all very high source of very elevating the uric acid in the blood. Now people with this gout who have elevated uric acid, they should not take this aerated drinks which contain fructose and all. So you should completely avoid soft drinks. Now you can ask me, Dr. Ramakrishnan, you spoke about diet and various arthritis. What is it? What lifestyle modification I should avoid as far as I should adopt as far as arthritis is concerned? I got arthritis. I will not modify the lifestyle. That is an absolute myth. The fact is you have to modify the lifestyle. How do you modify the lifestyle? You modify the lifestyle by taking the correct and well-balanced nutritious diet, maintain the ideal body weight. That is very, very important. Don't indulge in alcohol and please do not smoke. Smoking is very, very bad for arthritis. It's not at all good. Not that smoking is good for any disease. Well, you know that smoking is injurious to health. They put it in all advertisements. If you have been smoking, I would request you to stop smoking. If you have been smoking and stopped smoking now, then don't restart it. If you have never been smoking, don't start smoking now. Smoking is absolutely dangerous for health, and for all patients with arthritis, it does a lot of harm, smoking and consumption of alcohol. Then people come and say, I got arthritis, my joints are very painful. I cannot do any exercise. It is an absolute myth. People with arthritis should definitely do a good exercise program. This graded exercise program will be taught by the doctor as well as a physiotherapist. We have well qualified physiotherapists who come and advise you what sort of exercises one person should do for rheumatoid arthritis, one person for osteoarthritis where the knee joint gets worn out, one type of exercises for gout, etc. So it is absolutely essential that you see a physiotherapist and he teaches you all the exercise. But the greatest thing in this country, what I have told is people go learn the exercise and they don't do the exercise. They expect either somebody in the family to do the exercise or the physiotherapist to do the exercise. If you have arthritis, you have to do exercise regularly. There is no second option about doing exercises at all.